Welcome to the Stress Free Dentist Podcast. I'm your host, Dr. Eric Block. As always, I want to inspire, entertain, and educate you on the best tools and technologies out there. My goal is to help make your practice and career more profitable, efficient, and most importantly, more enjoyable. And check out all of my nonfiction and children's books on Amazon, and check out the stressfreedentist.com for any upcoming events. And if you're feeling you're a dental professional that's burnt out, or you just feel stuck or want to get to that next level, visit the International Academy of Dental Life Coaches or www.iadlc.com, and we'll get you matched up with a life coach that understands dentistry. I also wanted to thank our amazing sponsor, Equa Marketing. They have helped me and my practice over the years to improve with SEO and website performance. And to find out how you can make your practice dominate in your area, go to www.equa.com/MSMSFD to book your complimentary meeting. Again, that's www.ekwa.com/MSMSFD. All right, everyone, welcome back to another episode. And today we're joined again, actually this is for the second time, Brett Walisever, who's the CEO and founder of Ball Sales Training. Brett, thanks for joining us again.
Yeah, no, thanks for having me. I'm impressed you got the last name right. 2 for 2.
I practiced it over in my head. I practiced it over and over, and I got it. Man, it's been a while since you've been on, and you've been up to a lot of great things for dentists. Tell me about Ball Sales Training. What's that all about?
Yeah, no, thanks for having me on. I think the last time when I came on, we really, it was specific to dental patient finance. And so after a few years of doing that, when I say a few, I mean like 10, it was pretty evident that there are things that needed to be done in a dental office to even get to the point of discussing any sort of payment options or third-party financing, right? The level of treatment presentation has really been at an all-time low. It's really us dictating to the patient, hey, I'm going to tell you everything that's wrong with you, and I'm going to show it on a screen, and then I'm going to bring in a treatment coordinator, and we'll go over pricing on how to fix that. It's probably been taught incorrectly all these years, and if you think about every other industries, that's not how things get sold, right? So when we're talking elective patient healthcare procedures, if we're talking clear aligners, if we're talking implants, people make decisions with decisions versus choices. Okay, a lot of times in dental, we don't give them the choices, we don't give them the options. The decision is, hey, this is what's wrong, and this is what's happening in your mouth. Okay, and if you don't do it, this is what's going to happen. Okay. It's not a very effective way to sell. Sometimes it's selling it out of fear. And the goal is you really need to find out what's important with the patient and bring that out of them. Okay. If you don't have teeth, for instance, I want new teeth, but why, right? Why do you want that? Like, obviously everybody wants teeth, right? But tell me why. What is the reason? Like, you haven't had teeth for 4 years, but why are you here today? Like, why now? What made today different than any other day over the past 4 years? And when you start to dig out that pain point, that's really where you get into like emotional selling. And not 95% of buyers, they buy with emotion. Okay. And they justify with logic. In dentistry, we ask patients to use logic to make a decision. Okay. And it's the complete opposite. If people buy with emotion, why are we asking them to make a decision? And so that struck a chord. And that's really the basis of the training program.
So you started in patient financing, which was like a third-party financing. But you're right, that's sort of at the end of the line, and there's so many steps that have to happen before that conversation even comes up. I mean, first the patient, you got to market, and then the patient's got to call, you got to crush the phones, and the patient's got to come in, and then you got to give a great case presentation and get that patient to accept treatment, and then finally get them to accept the financing.
Yeah.
You're so right. So you're kind of on the back end of things, and now you're helping dental offices with more of essentially getting patients to move forward with treatment, right?
Yeah, exactly. Right. It's really, yeah. Well, obviously you have to get the patient there, right? So you're marketing, you're working them through a funnel, you get them in for a consult. That part is great. I would say if you can get the patient in there that day, there is a reason why he or she is there. It's because there's a pain point. Nobody wants to go to the dentist for fun, right? And so they are there for a reason. It's our job to extract that reason, okay, and then get them to move forward, right? So it really starts with the doctor's consult. I see a lot of doctors, they walk into the consult, they say, hey, so tell me why you're here today. It's not a great question, right? Because, okay, I advertised, I got the patient in here, right? It took 3-4 calls. I had to do my follow-up. Okay, the patient came in responding to a dental implant, either whatever the case may be, even if it's word of mouth. Like, I know why you're here today, right? So I'm not going to ask you, hey, tell me what you're doing, in the office today. I know why. The question is like, why now? Okay, why are you doing this now? Okay, we're going to talk clinically first, and I want you to think during the process. Okay, tell me what this would mean in your life as I'm discussing all of this. And then at the end, okay, let's talk about moving forward. Okay. And so really the question is, tell me what's going to change in your life specifically. Tell me that pain point. At the end, you say, you know what, Eric, I know why you're here today. I understand what your pain point is. Okay. If you're comfortable, we're comfortable treating you, would you like to move forward? And if the answer is yes, then you're bringing sort of the third party payment options, okay, and say, hey, you know what? My treatment coordinator, Brett, I'm going to bring him in here, and we're going to find a way to make this happen. And I haven't really touched on price. I haven't talked about how to pay. I haven't discussed anything, right? But I know this: the patient wants to move forward. Okay, so we got the yes. Now, in practice, we need to find a way to make that happen. Like, what is it? Now, the patient came in, right? So there is a want, a desire, a need. Okay. Maybe in those 4 years of putting this off, maybe they have saved up money, right? Maybe they have some money. Maybe you don't even need to offer third party financing, right? And so just starting to understand all those things, but giving options. Okay. It can't be, you know what? Thanks, Eric. Okay, so for this, it's $22,000. How would you like to pay? Well, that was very aggressive. Like the doctor just gave me a really nice case presentation, and it seems like all you want now is $22,000. Okay, if you walked in, even if you had like a piece of paper that you slid to the patient and it said cash, check, charge, or third-party payment options. Even if you had that and you just slipped it over to the patient, that would be better than throwing out a $22,000 number.
And you're actually making me rethink my process because, I'm a fully out-of-network office, and patients that come in, new patients are so much more valuable than they used to be, and
Yeah.
we do get less new patients,
Right.
Because we're not in network, but. I either see the patient for the new patient cleaning, so I'm with them for about an hour and a half. So I have a lot of time with them.
Mm-hmm.
But there's other cases where, and I think this is most often in dental offices, where the hygienist sees the new patient and then the doctor comes in at the end for like a 5-minute exam. It sounds like, especially if we want to sell and have them move forward with elective high value treatment, Should this be ideally done in the, move them out of the hygiene room into the dentist chair for like a separate consult?
Yeah, yeah. I mean, I would say this: if you have a surgery room, or you have a specific treatment room, or presentation room, bringing the patient out of the chair, okay, or if you do have that nice surgery suite where it's a chair but you're eye level, I mean that's really the move. It's okay now. You're done with your hygiene. Now we want to talk, okay, oral cavity. We want to talk about what is happening. And it's not, I think the important thing to understand is it's not, here's a prime example. You go into Jiffy Lube, right? You walk in, they take your car, okay? They come back into the waiting room and they hold up your air filter. They say, Eric, if you don't change this air filter, your car is going to have a lot of problems. Like, well, what problems? Just a lot. Okay. Or if you don't upgrade, in Massachusetts, it's really cold. If you don't switch to this synthetic, okay, you're doing yourself a disservice. Okay. But I still don't understand why, right? I came in to just get an oil change. And now, they're telling me basically my car's going to blow up if I don't do these things. Okay. Now think about a dental office. Okay. I'm going to take that x-ray, the pano, whatever the case may be. And I'm going to say, hey, Brett, this is what's happening. I can't really understand the x-ray or the pano. This is what's happening. And if you don't do this, okay, it's going to get worse. So there, you're asking the patient, okay, shoot, I came in for a cleaning and now we're talking about other issues and I'm not feeling pain. So what is it? Okay, well, the dentist just told me if I don't take care of this, then I'm screwed, right? Well, what does that do? You're asking the person to make a decision and not a choice. You're selling based on fear versus options. And the next time I come in, like, you know what? This dentist just told me if I don't get this treatment done, it's just going to get worse. So the next move is, do I go there or do I see somebody else? Do I trust going in there? Do I feel comfortable going in there? I don't want to get pitched the same thing every single time. Okay. And so that's why bringing options up, okay, is super important. And having, the one-on-one conversation of, okay, tell me what's happening. Tell me what's going on. This is what we're seeing. We work with patients in many different ways. Okay. We're here to help you.
And how would you, because I know you're exactly right. A lot of dentists sell through fear. This cavity is going to get worse and it's going to turn into a crown or a root canal. I think we're really, good at that. What would your recommendation be instead? Would it be something like, is it important to you to try to keep your teeth healthy, or what would you recommend there?
Yeah, something like that. I mean, you asked a really nice question, like an open-ended question versus a closed-ended question. Like, okay, again, like even the most basic, how are you doing today? Dentists don't ask enough. Like, hey, tell me more. Okay, why? Right. So if I'm giving the answers and I'm saying, yeah, no, I totally understand, but how come? Okay, it's really important to get the patient to talk. And the whole adage, right? You got one mouth, two ears. I mean, that's the thing, is keep asking the questions, understand what they're doing there today. Okay. What is going on in their life? For instance, okay, if it's someone who doesn't have straight teeth, it's like, hey, I know you come in for your cleanings all the time. Like, yeah, we really appreciate that. See how the patient's presenting. You can bring it up on their first visit. Say, hey, this is what we do in this office. The second visit, you can have a more in-depth conversation and say, hey, you know what? Is there anything that you would do right now to change your smile? Well, actually, yeah, I've never really been asked that, right? Like, I have halitosis. I don't have straight teeth. Great. Do you want straight teeth? Yes. But why? But why do you want straight teeth? Well, it's because I'm 29 years old and I want to find a partner for the rest of my life and I'm lacking confidence. Or I'm on a Zoom call and I keep looking at myself and I keep looking at others, and it's creating intimidation because I don't want to smile, right? Or I'm 65 years old and I want to get back in the dating scene. I'm 50 years old and I want to start going for a job that's really important to me, a promotion, but I'm not really looking the part, right? We see folks who get a lot fitter when they become CEOs, right? I mean, it's the same thing. It's the way you're presenting yourself. And, I don't know what the number is. You probably do, but it's sort of, the first thing that people recognize is your smile. And that's a big thing. So if you don't want to smile, like you see people like this all the time, right? And they shouldn't have to. They shouldn't have to hide from anything.
I love the following up with the why. And, there may be plenty of times where people are just in, they just want to get their teeth healthy. But, if you really want to dig in and offer some options of some elective high value treatment, that's where you really get into that.
Yeah.
It sounds like you're getting into like a psychology with them.
Yeah, exactly. Yeah. It's the psychology. It's like the art of selling. Okay. If there's a pain point, your job is to solve it. But if I'm not telling you what my pain point is, your job is to get it out of me. And the why. Tell me more. What's going on in your life? Like tell me why you're here today versus a year ago when you were at your other dentist. Tell me what wasn't meeting your expectations. But all that requires me to say something, right? And so quickly we want to combat that. And a lot of times we're already formulating the answer in our head, right? So we are missing a lot. I think people get nervous around sort of awkward silence, right? But it could be, the patient's getting a lot thrown at them, okay? They need to digest things in their head. They need to formulate a response. So the awkward silence, it's okay. What we usually do in a dental office is we just keep going, right? We hear the silence, patient didn't say anything. Okay, well, I'm going to start to say more. Now I'm going to say more. Now I'm running out of things to say, so I'm going to start talking clinically. Now you've just lost the patient. Now all they're thinking about now is, okay, whenever this person stops talking, I'm leaving. And here's the reality. Confused patients do nothing. They walk out, they don't do anything. They don't understand really what happened. And that's the truth.
Now, I think also sometimes they're not the only decision maker, whether it's their spouse. I know often a lot of dudes will say, I got to check with my wife.
Yeah, tons.
Do you recommend, let's say all the HIPAA forms and everything like that have been signed and everyone's okay with it, having that decision maker? It could be a parent, it could be a spouse, it could be, a loved one, come in for that consult so everyone's on the same page?
Yeah. I mean, it's really easy. Again, like if we don't know who the decision maker is, right? It's a question. Like, tell me how decisions are made in your family. Oh, okay, now I know. I don't do anything without talking to my wife. Great. Is she available? Can we FaceTime her, or can we set up a point where you both come in? Okay. This is not just impacting your life; it's impacting your family's life. I mean, whatever the case may be. If you're all of a sudden a new grandpa and you're wearing dentures and you're scaring your grandkids, understand like what is the family dynamic? Again, why are you really here today? Like, what now? Well, it's because my dentures fall out and I scare the crap out of my grandkids. Okay, like that is the pain point. It's not that I have teeth or don't have teeth. I'm scaring my grandkids, right? Or my wife never wants to kiss me anymore. There's a whole bunch of things. And a big financial decision, again, it's all about asking, who makes the big financial decisions? Tell me how that's made. Well, you know what? I do everything, so I can say yay or nay right now. Okay, great. Like, I'm talking to the right person. Obviously, if it's a child, right, and braces or under 18, that's a different story. You want to ask, because you know what? It might not be the mom who's the decision maker. It could be the grandparents. It could be the mom who's the decision maker, and the grandparents are willing to pay for that treatment. But if you don't know, I don't want to say you're wasting your time, but you're talking to the wrong folks.
Yep. Yeah. If you don't ask and you don't figure out the why, then you could be just wasting a lot of time and energy. Now let's say we've figured out the why, we've spent the time, and it sounds like, for these patients, you really got to get them into, a special, time for a consult so you can focus on this and not be running around and checking 5 hygiene patients. And you really need the time because they want to know that you're actually listening to them.
Yeah. I mean, it's really about having a patient for life, right? If you take the time, I'm going to take the time.
You figured out the why. Now tell me about the big F word, financing, and getting them to move forward.
I mean, I see all the time, like, oh, we have financing. Okay, financing. I'm thinking like my house. I'm thinking credit cards. I'm thinking stress. I'm thinking anxiety. I might be thinking bankruptcy, right? When you're adding a something that you have to finance, you think about like, holy cow, how much is this thing? Okay. Now the alternative is, hey, we have payment options. Okay. Now the reality is, if someone has the money to pay for it, right? You want to understand that because you don't have to offer financing, right? Well, like you don't have to offer payment options. It's nice to have, but if that gets uncovered, so many treatment coordinators are quick to bring it up. They bring it up. Why? Because it's easier, right? Eric, we have 12 months of 0%. We have 24 months of 0%. It's actually doing the office a little bit of a disservice. When you have to pay the financing company 20%, you could take the 20% that you would pay the financing company, right, and offer a 10% discount and still make out if the patient has the money to pay for it. Now, so understanding that, like, what are the options here? Okay, again, if I go back to, I'm not going to say a word. I'm just going to pass them a slip, and I'm going to say, okay, I'm just going to write down. I'm going to say it's 22,000. It's maybe 20,000. Cash, 21,000 charge, or $600 a month. So tell me what works best for you, and I'm looking at that. Great. If I can pay 20,000 and save $2,000, yeah, I'm going to pay that way. But you didn't verbalize the 22,000. You just wrote it on a piece of paper. Okay. A lot of people, and it's different for everybody, but what you don't want to do is alienate the folks who do not have the money. Okay. 22,000. Wow. That's a lot of money. You may have the money, but you might not want to part with the money too. Okay. So it's understanding, okay, what is comfortable for this patient to move forward? Okay. Using the terms like financing, especially right away in the conversation, it is not a good move at all. Right. You don't want to put someone in, well, I should back up. You want to understand what the patient is going through right now in their life. Right. And this is a big decision. And now, are you adding? Two of the top life stressors are, my health and my financing. Mm-hmm. One, are we solving one problem to just give another person another problem? Like that's not a solution. It's great for the office, but that's not really a solution for the patient, right? And so, understanding all of that will really give both the treatment coordinator and the patient like the answer on best moving forward. Hopefully that makes sense.
You said the words treatment coordinator is, let's say I have a patient, we've discussed the why, we've figured out what their motivations are, where they are in their life, maybe regarding finances. It's a big treatment plan. Do you recommend that we try to do whatever we can to give the patient the treatment plan and estimate that day right there, or should we have them come back in, or is
no? I would say, again, it's all about asking, like, hey, are you? I know you digested a lot. Are you comfortable today discussing the next steps. Okay.
Mm-hmm.
Again, a lot of people work with us in different ways. Some want to digest it, some want to go home. If you leave today, when can we schedule the next follow-up? I think that's the most important thing is folks let people walk out of the office and just, it's amazing because in hygiene, you always schedule, right, the next 6 months. But on a big implant case, it's like, oh, well, we'll follow up with you or call us when you're ready, right? And really, the low-hanging fruit in a practice are those existing patients. Okay. So when you get new patients, you really need to keep them, right? Because that really is your pipeline. The existing patients, your next big case is probably going to come from there. Okay. So having these discussions is really important to start generating some of those elective cases. And a lot of times it's, a lot of people don't want to bring stuff up because like, I don't want them to stop coming to the practice. Right. And that's really, you have to have sort of the feel of sales, meaning, okay, do I push this patient? Is this a patient that needs to be pushed, or do I back off? Understanding the types of personas that are in a practice is important. Like I'm a person that really needs to be pushed. If you tell me, hey, you need Invisalign, and this is what it's going to do for you, I'm that patient. My wife, if you tell her she needs something, she clams up and she leaves and she's like, I don't ever want to go back. But again, it's all about asking the patient, are you comfortable discussing this? If you're not, tell me right
idea I love the idea of what you said of creating a follow-up appointment. Like you said, we do this in hygiene. We said, got to get their recall in and get it on the schedule. Why don't we do that with restorative or with after our consultation, set up for the next consult if they need some time. I think that's a great idea.
Yeah. And really, the sales training behind it is, this is what I tell people, in corporate America, good sellers, they get 30 to 60 hours of training per year. In private dentistry, and you touched on it earlier, when I'm doing these consults, people are running around. If the person that you have pitching a $20,000 case is also on the phone right now, is also dental assisting, we need to call them from another room. I mean, whatever the case may be, that is not a good setup to really close these cases. If I want to sell you something for 20,000, I want your undivided attention, and it really needs to be like a one-on-one type thing. And from the office perspective, I want to invest in someone. And this is what I do. I sit down with the practice. I say, okay, who do we want to invest in to be your seller, your closer? Okay. And what do we need to get there? If there's nobody in the office, we'll identify that and then start from scratch. But it's really, really important. You need to invest in the people that you want to, with the type of office that you want to have. If you don't want to do any restorative work and you just want to, keep it as a hygiene type office, then invest in your hygienists, right? But if you really want to do implants, if you want to do clear aligners, if you want to do cosmetic cases, 6 through 11, these are high value cases. They don't come around a lot. So when you get it, it's important that you take it as far as you can and build that into your pipeline. And so when you have the right setup, okay, it's just like any other sales job. Should that person be compensated above and beyond for closing a sale? I would say yes. Okay. Now, what I've created is an incentive plan. So my seller, my treatment coordinator, treatment manager, like whatever you want to call them, now, are they going to be motivated to pick up that phone call from a patient a week ago that sort of stalled out? Like the answer should be yes. I'm going to call, even on my day off, for instance. If I keep making the phone calls, more things will happen, right? And we're not there to motivate a seller, right? The motivation should be, you know what? I'm going to drive more revenue to the practice. I'm going to make more money. I'm going to become more important to the practice. Okay. But our job is really to motivate that person and say, hey, this is what you can do. And and get them to want to do it and not feel like it's just my job.
And tell me about your sales training program. How does that work? Is it one-on-one with the office or with the treatment coordinator, or like you just mentioned, the person we're empowering to be our sales
Yeah.
leader?
Yeah, it's a good question. I tried to do something really different, and it was I see so many of these big groups, the classes. Hey, I'm going to sign you up, and I'm going to teach you how to do full arch, treatment planning, and I'm in a room of 20. It's good, but again, I wanted to do something different. I sit with the office for 1 hour, and we talk about, hey, tell me where you're at in life. And it's the same thing as us talking to a patient, for instance. Like, what are your pain points? Tell me where you want to be. Like, do you have an exit plan? Are you just working? Like, to just tell me what your goal is. Well, I want to get into implant dentistry. Okay, where are you at right now? I mean, I've taken all the CEs. I'm only doing 2 arches a month. I want to get to 5 to 7 arches a month. Okay, great. Like now we have a goal. Okay, tell me how you're going to do that. It's like, I'm not sure. Okay, so that's where I help devise a plan. Okay, now who is going to sell these cases? Like, doctor, are you going to sell them? No, I don't want to be the seller in the practice. I don't want to talk about money, and I don't want to be the one following up all the time. Yeah, it's totally fair, right? So who in the practice is going to take over that role? Okay, and what skill set do they have right now? What do we see in them that they want to or can take this role over? Okay, and then we identify that 1 to 2 folks, and I do personal one-on-one training. So I do 2 hours a week. One on technical sales training, including scripting, SOPs, role play. And I would say this for people who are like, role play, I don't want to do it. The only way to get good is through practice and repetition. There is no other way. There's no shortcuts. Okay. And if you're talking to a patient for the first time and those words are coming out of your mouth, it's going to be disaster, just like someone's, first sales call of their career. You feel like you're the seller who puts the foot in the door and say, oh, by the way, this, and by the way, that. And you realize, holy cow, I look back when I was 25 years old, I was terrible. You just don't know what you don't know. And you need all the experiences, and you need all the training that you can get. And again, that's where folks lack is, you know what? This person has the gift of gab. Like, I've heard this so many times. Eric's got the gift of gab. He'd be a great seller. Okay. The gift of gab is not selling. The gift of gab is I can strike up a conversation with anybody. Great. But again, that's not selling. Right. And so investing into that person, if that person's not there, then we go find them and hire them and incentivize them and put together a structure, put together, I asked like so many doctors, did you put together a comp plan for this? Did you put together a job description? Right? Did you put together expectations? You know how many folks hire without that stuff? And so when you have clear, concise goals and structure, the employee knows exactly what needs to be done. There's no room for interpretation whatsoever. It's clear, concise, and the reality is it might sound a little harsh, but people understand. Okay. And then you're able to have those conversations afterwards. So I do 1 hour of technical sales training, and then I do 1 hour of case review and bring a case. Let's see where it's stalled out. Let's see what questions were being asked. Can we recover something like this? Or do we put it in the pipeline to keep on revisiting? And last week with one of the clients, like we found one and they didn't want to sell the highest price thing. It was a full arch zirconia. They went with the middle grade material, which was $15,000 instead of going for the $22,000. It's like, you know what? This patient could have easily spent the $22,000, right? And they may have appreciated, right, the upgrade. Okay, so let's go back. Let's just ask them a couple questions and let's see if they do want to move forward. And from there, you've generated $5, $6, $7,000 for the practice in a matter of 1 hour, just 1 hour, because you asked the right questions. And if it wasn't going that way, it's okay. Like you still have, but understanding where to push, where not to push, the certain personas, and really, again, asking the questions. And I tell everyone too, I said, if you're having trouble getting the words out of your mouth, okay, I'm telling you, write it on a piece of paper, walk in and just read the words, right, off of the piece of paper. I'm telling you, you have to do that. If you don't, then you'll never, ever be comfortable. You're going to say the wrong thing. And really, at the end of the day, I tell people all the time, if everything goes awry, just go back to one basic question. Say, Eric, tell me what's the most important thing to you right now. Okay. And that will steer you back on the right conversation.
Oh, that's great, man. I love it. Now let's wrap up with two final questions.
Sure.
One is, how do we find out more about what you're up to? You can leave an email, phone number, website, whatever you want to leave.
Yeah. So my email is Brett, BRETT, at ballpayments.com. Cell phone, 702-324-1221. Happy if you text, it could be easier. My website, ballpayments.com. So yeah, I mean, however you want to reach out. I do partner with a company called TuaPay. They are a really good third-party lender, and they do different things. So it's not just your typical lender. They will sponsor 5 1-hour consults to really take a look at the practice and see if this is a good fit. And so normally it's $250 for the first hour. Okay, but Tua is happy to cover that.
Awesome. And final question, what advice would you give to the young dentists out there?
Yeah, that's a really good question, because when I was in patient finance, I'd say, hey, get into this and this and this, but it's really, it's the young dentist, understand like what you're getting into and understand what you're good at. I would say that find a lane that you want to go down, and whatever that is, become an expert at it and really work at that. And if it's something that you want to change, it's easy to change in this industry. I mean, how many dentists have become entrepreneurs, right? How many assistants have become dentists? How many hygienists have become dentists? How many dentists have left and gone into private equity, for instance? There's a lot that you can do. And so I think just having an open mind with the industry is important, and understand sort of what is happening around you. Be vocal, right? Like go in the groups, go with the CEs. At the CEs, you're learning, but really when you'll learn more talking to your counterparts and understand, hey, what are you doing in the practice? And I think a final thing is, don't be afraid to ask for help. That's an important thing. It can get very costly, very time consuming, learning things on your own. And we're in a day and age now where the information, it's right there, but a lot of people just don't want to ask. And so I would say it's okay to ask for help. I used to not either. And now you realize, the older you get, you're like, oh my gosh, I wish I had the information 20 years ago. Right. And so a lot of us fall into that trap.
That's so true. All right, Brett Walisever, such a great episode. Thanks so much for joining us.
All right. No, I appreciate you having me.
Thanks again for listening to the Stress Free Dentist podcast. And don't hesitate to get in touch with me at info@thestressfreedentist.com. And if you haven't already, please subscribe on your favorite platform and leave us a review. Until the next episode, I'm Dr. Eric Block, the Stress Free Dentist.